Abdominal Viscera, RAD 310, Sectional Anatomy, Bachelor of Science in Medical Imaging Program, Chris Gibbons instructor. This module presents the organs within the abdominal cavity. For the purpose of identifying these organs on sectional images, it is essential to understand the exact position of each organ relative to others in the abdomen, as well as the boundaries of the abdominal cavity. Sectional imaging of the abdomen can demonstrate numerous diseases of the organs, such as tumors, masses, trauma, and infection or inflammatory conditions. On the screen here is a CT axial. The arrows point to a marked thickening and irregular border of the wall of the stomach. Ascites is also seen in the peripheral spaces. This is an indication of gastric cancer. Upon completion of this module, you should be able to 1. Describe the location and position of each organ in the abdominal viscera. 2. Explain the anatomy of each organ in the abdominal cavity. And 3. Identify abdominal organs on sectional images. The liver is the largest solid organ in the human body. It comprises most of the upper right quadrant of the abdomen, with the left lobe crossing into the left upper quadrant. There are 4 major divisions or lobes of the liver. They are the right lobe, the left lobe, the caudate lobe, and the quadrate lobe. The falciform ligament is the primary supportive structure and divides the right and left lobes. On sectional images, the normal liver parenchyma is homogeneous in X-ray attenuation and MR signal. This is a sagittal CT image of the liver. Note the location and shape of the superior liver, following the curve of the diaphragm. No other abdominal organs are superior, anterior, or posterior to the liver. Also note the proximity of the right kidney to the posterior liver. Additionally, a portion of the colon is immediately inferior to the mid-portion of the liver. And lastly, near the anterior aspect of the liver, the fundus of the gallbladder is seen. This is a coronal CT image of the liver. As in the previous image, the liver demonstrates as a uniform gray density. Looking at the locator diagram, this coronal plane is quite posterior, as evidenced by the appearance of the psoas muscles and the lumbar vertebrae at the bottom center of the image. This image shows how the liver encompasses most of the right upper quadrant of the abdomen. Additionally, the left lobe can be seen crossing the midline of the body and adjacent to the stomach. The neck of the gallbladder is labeled on the left side of the image. Locate the small, darker gray circle, as that is the appearance of the neck of the gallbladder in this particular image. The gallbladder is a small pear-shaped organ situated in a fossa on the posterior right lobe of the liver. The fundus of the gallbladder often hangs slightly lower than the anterior border of the liver, pointing toward the right, while the body and the neck are situated toward the left, upward and more posteriorly. Sonography is used most often to image the gallbladder, but as we saw on the previous image, CT will also demonstrate the gallbladder. This screen illustrates an axial MR image at the level of the gallbladder. This might be a good time to pause the video and work your way around the image, identifying all of the anatomy presented here. This image is a sagittal CT, obtained slightly more medial than the sagittal CT of the liver in the previous screen. Notice how the body of the gallbladder is demonstrated in this image as compared to the fundus that was demonstrated in the previous more lateral image. The gallbladder body is also seen more posterior as compared to the previous sagittal CT image of where we saw the fundus. This coronal MR image demonstrates a more anterior plane of the abdomen than the previous CT image. The gallbladder is the high intensity or white image, almost a round structure, on the inferior lateral aspect of the liver. Based on this location, this is likely to be closer to the fundus of the gallbladder. The biliary ductal system conveys bile, produced by the hepatocytes of the liver, to the gallbladder for storage and concentration. Ultimately, the biliary ducts deliver the bile to the duodenum or duodenum for use by the digestive system. The major ducts are as follows. We have the right hepatic duct, the left hepatic duct, the common hepatic duct, the cystic duct, and then lastly the common bile duct. Here is an image from our friends in ultrasound. This sonographic image demonstrates the common bile duct in the sagittal plane. The common bile duct is commonly located between the hepatic artery and the portal vein. The gallbladder is superior to it, and the inferior vena cava is the most inferior structure that you see in this image. The cystic duct is indicated by the arrows in this sonographic image. It is seen coming off the neck of the gallbladder. Also demonstrated is the portal vein, the inferior vena cava, and the aorta. The pancreas is a long, narrow organ situated transversely in the upper portion of the abdomen. The pancreas is a vital organ because it functions in both the endocrine and digestive systems. The wider head of the pancreas lies to the right of the mid-sagittal plane within the curve of the duodenum or duodenum. The more narrow body crosses the midline and continues to taper to the end at its tail. The head is the most inferior portion, while the body is the most anterior portion. This screen image is a coronal CT curved reformat that demonstrates the pancreatic duct and all three portions of the pancreas. The spleen is the largest lymph organ in the body. It is located in the upper left quadrant of the abdomen, posterior to the stomach. Lateral and posteriorly, the spleen is bordered by the ribs 9 through 12. The upper posterior spleen lies in contact with the diaphragm, the pleura, the left lung, and ribs. On the medial side of the spleen, it is bordered by the left kidney, splenic flexure of the colon, and the tail of the pancreas. This is a sagittal CT image demonstrating the spleen in the posterior left upper quadrant of the abdomen. Notice the tail of the pancreas near the medial inferior border of the spleen and the left kidney at its inferior aspect. The stomach is anterior, while the diaphragm and the left lung border the superior and upper posterior borders. This is an MR image in the coronal plane. Notice the posterior section as indicated in the locator diagram. The spleen is seen in the upper left quadrant, just below the left hemidiaphragm of the lung. The ribs are on the lateral side, and the medial aspect is bordered by the pancreatic tail and left kidney. The kidneys are retroperitoneal organs and lie on each side of the vertebral column. The relationship of the kidneys with respect to other abdominal organs has already been discussed in some of the previous screens. Remember that the adrenal glands sit atop the medial aspect of the superior part of the kidney. The adrenals typically present as small triangular or V-shaped structures in axial images. Sectional images can demonstrate many diseases of the kidneys and adrenal glands in all the various planes. This is an axial MR image demonstrating both adrenal glands. The adrenals lie on each side of the aorta near the midline. The most superior aspect of the upper pole of the left kidney is also demonstrated. The right kidney is just inferior to the liver, and so it is not seen on this image. What's also demonstrated in this image is the typical V shape that you will note for adrenal glands in axial images. This image also demonstrates both adrenal glands on the superior and medial aspect of both kidneys. Also of interest is the anatomy of the kidneys, and note the detail demonstrated for the renal pelvises. The stomach is the most dilated portion of the digestive tract. It has three portions. Now going from superior to inferior, they are the fundus, the body, and the pyloric antrum. Position of the stomach varies greatly with body habitus and its contents. The fundus is the most posterior portion and lies immediately inferior to the diaphragm and anterior to the spleen in the left upper quadrant of the abdomen. Medially, the liver is adjacent to the stomach. Generally, the body is seen first in most coronal images, making it the most anterior portion. This screen image demonstrates the contrast-filled stomach with the lower lobes of the lung still visible. This illustrates the fact that the stomach is in a superior position within the abdomen. Let's turn our attention to the small intestine. The entire 6 to 7 meters of small bowel loops upon itself and occupies the most center portion of the abdomen. The small intestine joins with the stomach at its proximal end, and it ends at its junction with the cecum of the large bowel at the ileocecal valve. The small intestine consists of 3 portions. We have the duodenum or duodenum. Now this is the shortest, widest portion and begins at the pyloric sphincter. We have the jejunum, which is the middle portion. And then we have lastly the ileum, which distinguishes itself by being the longest portion of the small intestine. Sectional images can demonstrate all parts of the small intestine, and great amounts of detail are provided via reformatted images, virtual CT colonoscopy, coronal MR, and CT colonography. This image illustrates a CT colonography, while the next one we will look at will demonstrate an MR colonography. In this image, we find the large intestines surrounding the periphery of the abdomen and the small intestines. The large intestines consist of the following portions, and they're listed in physiological order. First, we have the cecum, followed by the ascending colon, right colic or hepatic flexure, transverse colon, left colic or splenic flexure, descending colon, the sigmoid, and then finally we have the rectum and anus. And again, this image illustrates an MR coronal colonography. We'll start our image review with an axial MR image of the upper abdomen. Both lobes of the liver are demonstrated in the anterior right lateral and right lateral posterior portions. The most superficial structure demonstrated on the left side of the abdomen is the splenic flexure of the colon. Just deep to it and slightly medial is the body of the stomach. The body of the pancreas is posterior to the stomach. Posterior to the pancreas is the triangular-shaped left adrenal gland. Just below it lays the left kidney. Lateral to the left kidney is the spleen. Now look at the vertebral body and note the most superficial aspect of the upper pole of the right kidney between the liver and the vertebrae. Look just above the upper pole of the right kidney and note the right adrenal gland just between the inferior vena cava and the aorta. This is an axial CT image with oral contrast filling most of the stomach. Posterior and lateral to the stomach is the spleen. Medial and posterior is the left kidney. Between the stomach and the left kidney, a small portion of the jejunum is seen. On the opposite side, most posterior is the right kidney. Lateral to that is the liver. Anterior to that is the head of the pancreas. Now between the liver and the pancreatic head is the hepatic flexure of the colon. Just anterior to that position is the gallbladder. And then lastly, the atrium or the proximal pylorus of the stomach is seen filled with contrast. This is an axial of the lower abdomen at about the level of the umbilicus. This is a good image to pause the video and study and note the sections of the small and large bowel demonstrated in this particular image. This is a sagittal CT image through the hilum of the left kidney. It is seen adjacent to the posterior abdominal wall. Superior to it is the spleen. Now anterior to the spleen is the fundus of the stomach. Looking at the most anterior and superior structure is the liver. Just below the liver is the body of the stomach. Between the stomach and the kidney is the jejunum of the small bowel. Just below that, we find the transverse colon. This is a sagittal CT of the medial aspect of the left abdomen. Anteriorly and superiorly, the left lobe of the liver is seen. Posterior to that is the stomach and the spleen. Inferior to the spleen is the superior pole of the left kidney, with the adrenal glands seen immediately anterior to that. The contrast-filled splenic vessels are between the adrenal gland and the pancreas. The stomach is anterior to the pancreas and tucked behind the liver in this image. The duodenum is seen inferior to the pancreas and posterior to the stomach. Inferior to that is the transverse colon. And lastly, the sigmoid colon is visible at the bottom anterior aspect of the image. This is a sagittal MR image on the medial aspect of the right side of the abdomen. The entire superior aspect is filled with the liver. Just below it lays the stomach anteriorly with the duodenum or duodenum immediately posterior to it. The right kidney is seen posterior to the duodenum, and the head of the pancreas is anterior to the right kidney and inferior to the duodenum. The transverse colon is that air fill structure in the anterior middle of the abdomen. The small bowel is seen inferior to that. For our last image in the image review, we have a coronal MR image at about the middle of the abdominal cavity. The liver is the most superior organ on the right and extends slightly over to the left side. Inferior to the liver, on the right lateral side, is the gallbladder. Next to it, closer to the midline, is the antrum of the stomach. The fundus is seen just below the left lobe of the liver. Looks slightly lateral to the stomach and down, and the splenic flexure of the colon is seen with the jejunum of the small bowel visible below both of those structures. On the right side, the hepatic flexure of the colon is seen just below the gallbladder. The transverse colon is seen horizontally below the hepatic flexure, and then the ascending colon is on the right inferior aspect.